In this video, I want to talk to you about trauma-informed care. Whether you are a survivor or a professional or somebody who's just helping out the next door neighbor, it's important to understand that impacts from trauma can be minimized with the right approach. The most effective and primary approach to be considered is the utilization of what's called trauma-informed care. Trauma-informed care ultimately does a few different things. One, it recognizes the prevalence of trauma among all people. And this also includes trauma that may have occurred when you were younger or when they were younger, something that equates to what's known as adverse childhood experiences. Number two, it recognizes that many behaviors and symptoms are the result of traumatic experiences. Every human wants to do well, and if I'm not, there's a reason I'm not. And number three, trauma-informed care recognizes that being treated with respect and kindness and being empowered with choices are key in helping people recover from their experiences. With these core components stated, it's also important to remember that the behavior that you or others display and harm that you or others cause is not excused by your experiences. It simply helps us to understand what's fueling them. The guiding principles of a well-built trauma-informed care system includes things like creating safety in all interactions and environments, being trustworthy and a transparent person or organization, providing choice and autonomy when you need to, ensuring collaboration amongst all positive and healthy support systems, and lastly, focuses on empowering every person to live up to their fullest potential. When the system comes together as one, we begin to see interactions focused on building up a community rather than tearing down a community. No matter your experiences, every human being deserves to be treated with dignity. A system designed to serve and interact in a trauma-informed manner creates dignity through respect. It is always okay to ask, and more importantly, to expect that these comments are applicable to you, as well as to the individuals around you. So no matter what your role is in the community, it's okay to have that expectation. It should exist no matter where you're at. Trauma-informed care is a concept that has been in place for many decades at this point. The research behind has proven its effect, and organizations, agencies, and providers should be rooted in trauma-informed care concepts. So what does this mean to you? How does this all play out? You can build this concept for yourself with healthy supports, healthy coping strategies, and healthy living that supports resiliency. You can also ask others to be a part of this process by simply planning with you, not for you. By problem solving with you, not for you. And by partnering with you, not against you. Those are the core components of a trauma-informed care system. So how do I build those as an individual, or how do I ensure that I'm doing this for others? Let's break it down just a little bit. When we look at one of the first components, we talk about safety. And we talk about being able to build safety everywhere. Safety isn't just about who's present or a direct threat to me. Safety is about my mind, body, and brain's ability to be calm, to be okay. Environment can play a huge role in what safety looks like. So the next time you're thinking about the situation that you're in, or the situation that you're going to put somebody else in, ask yourself, what does this environment provide for this person? I can be a safe person, but does the person feel safe in the environment I provide? Second, we talk about being trustworthy or transparent. We know that trust is an important component to vulnerability. And many times we're asking ourselves or we're asking others to take a vulnerable stance. The question is, are you going to be able to follow through on what you say you're going to do, or are those around you going to follow through on what they say they're going to do? Are you able to be honest with yourself and others? And are others able to be honest with you? Do you have the ability to be straightforward and not try and find that backdoor approach? And ultimately, are you open to the idea of other opinions and other options? All of those build a trustworthy system. Third, you have to ask yourself about choice. What is choice? What does that mean for me, and what does that mean for others? A natural, innate necessity, a basic need for every human being, is to simply know what's coming next. When we're provided choices and we have the ability to make our own choices, we build a system that allows me to be a part of what's coming next. You begin to meet my basic needs. Fourth, collaboration. We spend a lot of times as human beings trying to fix things. It's our innate capability and it's what we do best. The question is, does everything always have to be fixed? And if we fixed it for ourselves, does it actually help others? I want you to think about what collaboration would mean to you. Is everyone on the same page? Are the supports that are involved talking to each other? And most importantly, am I involved in those conversations? Or if I'm on the professional side, have I involved those I'm helping in those conversations? Lastly, and I think most important, is to be empowered, to build empowerment amongst yourself and amongst those that you are working with, no matter who they are. We empower ourselves by challenging the lens that we wear. How do we see things? How do we view things? We also can be empowered by others by taking in their responses, listening, being a part of them, considering them, and determining if they're genuine. And when they are, consider doing something different. You might find some new successes within that. What I would love for you to take away from this video is this. When we talk about trauma-informed care, you as a human being, no matter your experiences, you have a right to be treated with dignity and respect. Treat others using these concepts and you demonstrate trauma-informed lenses. Expect it or ask it from others and you can create a trauma-informed lens for yourself.